This Krost Symposium panel, and let me go ahead and give a brief introduction to the panel, and then I'm going to let them tell you a little bit more about what they do. So we have Wendy Gumbert, and so Wendy has over 33 years of experience in adapted sports, and you can imagine after 33 years how many things she's directed and coordinated. We'd be here all day if I read all this to you, but I'll let her tell you a little bit more about what she does. The one that stood out to me the most was six-time U.S. Paralympic national team coach for both track and field and wheelchair rugby. So let's hold our applause till I get finished here. But our second one is Dr. Register, which is so strange for me to say that, because when I knew her, she was Summer Swift, and she was a kinesiology student, graduated in COVID years, and went on after TLU to graduate from the University of Texas Medical Branch, UTMB, in physical therapy. And she is mainly interested, she'll tell you more about it, in limb loss population. In addition to her clinical work, she's also a professor at North Texas in their physical therapy program as well. And our third one is Dr. Elise Gray, which I knew as Elise. She graduated from TLU in 2021. I had the honor of having her for a couple of classes as well, even though she was not kinesiology. She was double major integrated science and psychology. But we also got to go to Italy on a study abroad trip. After TLU, she went on and got her doctorate in OT at UT Health San Antonio. And she'll tell you a little bit more about how she got to where she's at, and she really likes to specialize now with the burn victims. When she is not working, she also is a violist in the community orchestra, something she did here at TLU, and she continues that passion, and also enjoys spending time with friends, family, and Cooper, her golden retriever. And then our last one is Carrie Valdez, and she originally was a collegiate gymnast, and I think that's just really cool how God can use a talent like that in ways that you wouldn't even expect. Now she is with a program called Kinetic Kids. She's going to explain that to you, and was able to start like their first gymnastics program. And when she's not working, she likes to volunteer at church and spend time with friends and family. So at this time, let's welcome our panel. Okay, I'm going to let each of you just tell us a little bit more about what it is that you do. We can start here and go in order if you like.
Good morning. So what do I do? Well, I do a lot of different things. I am the founder of Texas Para Sport, and it is an organization that's a statewide organization that empowers people with physical disabilities through sport to be more independent, to live healthier lives, to breaking down barriers, all the things that we want to see for ourselves, but we're looking for that for people with physical disabilities so they can live independent lives. And through sport is the way that we do that. We do lots of events and clinics and such throughout the whole state. We collaboratively work with every adapted sports program throughout the state of Texas to help enhance and develop their programs. So in Houston or Dallas or wherever that might be. I started in Warm Springs Rehab Hospital. When I first graduated from school, I went to school at Texas Lutheran. I graduated in '89, so that'll tell you a little bit. I'm a little bit older than all these ladies up here, hence the 33 years of how I've been doing this. But I graduated with a adaptive PE degree. And that adaptive PE degree, you didn't have adaptive PE at the time at Texas Lutheran, but they wanted me to play basketball. So Dr. Yandel created a degree plan for me, and I was under Miss Lewis at the high school. You were talking about her predecessor, and who's there now at Seguin High School, and did my student teaching there. I learned through all my volunteer time that you have to do that adaptive PE wasn't quite the route that I wanted to go. I learned at Texas Lions Camp. I volunteered there or worked there in the summers, and I learned about Paralympic sport. And when I learned about Paralympic sport those summers at Texas Lutheran, I realized that what I wanted to do needed to be recreation therapy. So I went to Texas State and got a recreation degree and certification. At Texas Lutheran, they helped me to plan my plan so that I could go on and get that second degree. And that's the one that I've actually used all throughout. So recreation therapy is the degree that got me my job and has gotten me through. But that adapted PE is so similar. I use in so many things as well. So that gives you a little history of where I've come.
All right, hi, I'm Dr. Register. I graduated here in 2020, and I went to UT Medical Branch, like Dr. Helbig said. I ended up working in the Dallas area for the Baylor Scott and White system in the outpatient clinics for physical therapy. I was hired as a general orthopedic, knee pain, back pain, hip replacement, yada, yada, right? Well, my mentor or my CI during clinicals happened to have a large caseload of amputation patients, and I was like, oh, this is nice. So I kind of spearheaded that program. I built it up or assisted her building it up. So that's where my passion lies, working with patients with amputations, and that looks like either taking somebody from a fresh amputation all the way to walking, jogging, running, or whatever they want to do. Or it looks like, I've had an amputation for 20 years and now I have back pain. So you kind of have to work on both of those things at once. So it's a really flexible population in like what you're working on with them. So that's really fun and exciting. I'm also a professor at the UNT PT program, and I teach the prosthetics and amputation course. So that's been super fun and exciting as well, because teaching is another one of my passions. So I'm excited to be here.
Well, good morning. You guys are all showing up here at 9:30 in the morning, which is great. And I hope that you guys have had a wonderful time so far with Krost. But I'm Elise. I am a pediatric and NICU occupational therapist. Like Dr. Helbig was saying, I graduated here in 2021, and I didn't go the typical OT-PT route with kinesiology, which I know Dr. Short and Dr. Helbig were trying to get me to go that way. But instead, I majored in integrated science and psychology, and I feel like that gave me a great perspective and kind of like a wholesome perspective to the whole person, which helped in OT school, because with occupational therapy, similar to physical therapy, we look at the whole person. We look at things that they like to do, have to do, want to do every day, and getting them back to doing that. After graduating here in 2021, I went to UT Health. It's a 3-year program similar to physical therapy. And then shortly after, I got a job at University Health, specifically the Women and Children's Hospital. When I first started OT, I thought there was only outpatient OT. I thought that was the only option. In OT school, I was able to figure out all the different areas that an occupational therapist could work, and I had my clinicals at University Health in the pediatrics unit, and my mentor was the primary burn therapist, and so that's kind of how I got into pediatrics and burns, and then I was able to do my capstone from graduate school in the NICU, the neonatal ICU at University Health. And I'm really thankful that right now I've been there a little bit over a year, but I'm able to do all the areas that I love. So I'm working in pediatrics with a range of diagnoses. It's a level 1 trauma, and so all the traumas in San Antonio, surrounding areas, come to our hospital. A lot of, for example, TBIs, spinal cord injuries, burns, gunshot wounds, or just polytraumas in general is kind of the population that I see, in addition to oncology patients, transplant patients. So it's a very wide range, but that means I'm learning so much every day, and I have not stopped learning since leaving TLU. And I'm also working with our NICU preterm infant population, and like I said, burns. So very excited to be here with y'all today.
All right. I'm Carrie Valdez, and I'm also an occupational therapist that works in the pediatric field. And as you can notice, right, everybody has such a different, we'll have the same degree, but very different things that you can do with the degree. And I think that's a really unique thing about going into therapy, whether it's rec therapy, physical therapy, occupational therapy. There's so many different opportunities within that degree plan. So my journey, as she mentioned, I was a gymnast. I went to school in Utah. And competed and loved all of it. And I had a degree in, I think at the time it was called commercial PE. And I had graduated and wanted to do, or prior to graduation, wanted to set up education and wellness programs in businesses. And when I was graduating, they were kind of doing budget cuts in businesses, and that's kind of what they were cutting. And so I thought, oh, what am I going to do? My senior year, I tore my ACL, so anybody who has ACL injuries, not fun. A week before my senior year, and for my last, competitive season as a gymnast, so I had lots of therapy. So introduced to physical therapy, and so I was like, okay, this is what I'm gonna do. I'm gonna do physical therapy. That's my jam. And then when I had to do some shadowing hours, so. If you guys are interested in that, and I'll go into that with some of the other questions, but as I was shadowing, I noticed an OT, and I was like, what are they doing over there? I'd never heard of occupational therapy. I really didn't, really had never heard about it. And as Elise said, it was outpatient, right? And so, but the thing that drew me in is at the time, and I think PT and OT probably are compatible now, but 30 years ago, OT was very much about balancing work, rest, and play. And if one of those things is out of balance in your life, right, then dysfunction, illness can happen. And so if you think of your own life, right, if you overwork, or if you excessively play, or you don't get enough sleep, and so the profession really takes that into every single, whether you're an adult, a child, and so that really appealed to me. You do have to have psychology and these things, because of course that's the whole person. So that is kind of my journey as far as school-wise. So if you didn't do a kinesiology or something else, there's still other routes to go into therapy by doing the prerequisites. My first job was early intervention. I did my clinical at University Hospital and at Methodist Children. And so then from there, I was a school therapist for a bit in early intervention, and then I got into my current job as Kinetic Kids. And as they mentioned, combining gymnastics with pediatric therapy was such a sweet fit. So in 2003, I started the recreational gymnastics program, had lots of kids, and in and out of Kinetic Kids until today. So I've done a variety of roles using my therapy hat, as well adapting sports and recreation. So Kinetic Kids is a nonprofit, and we provide adaptive sports for kids with special needs. And so if you can think of a sport out there, we probably provide it. And so, but that's what I do currently, and I'll leave it there so that we can talk more with the next question.
Okay, they know this one's coming. Give us a specific story or specific case or something personal that has left a significant impact on you.
So there's so many. I'm going to give you a couple, though. But for me, why do I do recreation therapy? It's because I see that mom pushing that kid into the gym where that kid is completely dependent on that parent or that family member. Our job is not only the physical therapist, occupational therapist, all of us have the same, but in recreation therapy, it's through sport or recreation, is to make that kid independent. And after a year, sometimes a few months, it depends. Sometimes one session, it just depends. I can get those extra armrests off that kid, get the anti-tip bars off, take the push handles off that chair and say, no, Mom, never again. Don't push this kid. This kid can be independent. And the next thing I see is that kid competing in a competition, pushing their own chair into the gym, driving their own car to practice, completely independent of their parents. That, to me, is satisfaction, because that's why you do it, is to make these people independent, to live on their own, to get married. I went to a wedding recently of one of my kids. It was the greatest thing. I was like, this is so amazing. Here she is. I remember when she was pushed into the gym, and now I'm here at her wedding, watching her get married. So those are great memories. A little memories of a Paralympic sport. I can't tell you, I've traveled to so many countries coaching Paralympic athletes I will never listen to the national anthem again after watching our 12 athletes at the Sydney Paralympic Games in 2000 when they won the gold medal. And you watch all 12 of them get their medals around their neck and hear that national anthem. You never hear it the same again. So it's something that resonates inside of you forever. Sitting in the stands in Beijing, watching the marathon with my 5-year-old son. So this was much later in life, in 2008. And watching one of my athletes compete. They came by you 6 times in this course. It was a fabulous course to watch because it wasn't an out and back. And she kept coming by in that front pack, and my son looks at me, 5 years old. He's like, Mommy, I think she's doing good. I was like, yes, she's doing good. She's in the front pack, but there was 10 of them. And so we just keep cheering and cheering and cheering, and then she comes through the last lap. They come by us, the finish line's just down the way, and she breaks out of the pack and wins the gold medal. That was, and then, so the best part was this security officer comes over and he says, we go ballistic. We're screaming and just jumping up and down and going ballistic. And he goes, exactly who are y'all? And I said, I'm her coach. This is her husband, and this is my nanny, because I'm in no condition to take care of this child. The nanny was my friend who had just come on the journey with me, and she laughs about it today. She goes, I was the nanny? I was like, I didn't know what to say. So he said, come with me, and he took us to the VIP section and put us right on the front row to watch that ceremony. So that's cool.
Wow. When Dr. Helbig sent us these questions beforehand, I saw this question and I was like, I could talk for hours about my patients. So how do I choose one person or one moment? And you can't. So I'm going to be very brief on a few people. One of the most impactful parts of my clinical career so far, I said I work with adults with limb loss. One of my patients, I'll give you her backstory. She was a new mom. She's in her 30s. I don't know where she fell in the 30 decade, but she's in her 30s. New mom, like brand new mom. She delivered her child through C-section. Well, there was complications with the C-section that led to infections. So she had mastitis, so she had a double mastectomy, get rid of the mastitis. That didn't solve the problem. She still had an infection, so then her body went into sepsis. And sepsis basically says, I don't need limbs, I need organs. So all your blood gets shunts to the organs, the limbs die. So she had 4 amputations, below the elbow, below the elbow, below the knee, below the knee. And she's a brand new mom, right? Like how do you, like your life is so changed. So I saw her in the outpatient section. So she had already been through acute care and inpatient, and they did awesome with her. She had great balance, so they really just teed me up to finish it off. Like, they did all the work. Anyways, her goal was to be able to just run around with her kid just a little bit. Like, she didn't want to go run a 5K or a marathon, but if her kid's running into the street, she needs to go hurry up and get that kid away from the street. Or if kid, when they turn 5 or 6, they're playing softball or cricket or soccer or something, she wanted to be able to participate a little bit in that. So we did that. I taught her how to run. And that was so, I'm gonna get emotional. That was so emotional. Like, I was crying, she was crying, husband was crying. It was a great day. Oh. Anyways, okay. Another person, he was a policeman. He got run over by a car while he was on duty, resulted in trauma of both legs, but amputation of one of them. I met him when he was in his wheelchair recently after the incident, and he, wanted to be able to do anything that he wanted to. Like, I don't know if he wanted to go back to work, but he wanted to be completely independent. So he also wanted to learn how to run a little bit, so we were practicing that, and he was just a stellar patient where I took him from, or I didn't, he did all the work. He was in the wheelchair 1 month, and then 4 months later, he was learning how to run. And he was just that go-getter, I'm gonna do it. There's a lawn that needs to be mowed outside, I'm gonna figure out how to do that today. Like, he was just on top of it. He was great. So those are just two examples of how life-changing PT can be for the patient, most importantly. But you saw how emotional I just got, so it's a great career to go into.
It's hard to pick one like they're saying, but I think what's amazing is that you're going to have stories and experiences no matter how far in you are in your career. And so you're 33 plus years of experience, and she has so many great stories. And Summer and I are 2 years, 1 year out in our career, and so many patients have already impacted us, and we've been able to impact them. And as I was thinking about this question, I have so many stories that I could share, but one that came to mind that's very unique was they weren't even a patient in the hospital. So like Dr. Helbig was saying, I play the viola, and I played here with Dr. Jeffords. She's in charge of planning Krost, and she's done incredible with this. And so I have a love for music, playing the viola since 5th grade, and now being an occupational therapist. And my high school orchestra director in 2023, he approached me, and he is in charge of the 5th grade strings program in San Antonio for NEISD, the Churchill cluster. And he had something. He had 2 girls that wanted to play. One wanted to play the violin, and one wanted to play the bass. But they were both born with congenital abnormalities for their, one was her left hand and the other was her right hand. And so it made it challenging without any adaptive equipment to be able to play the violin and the bass. And so my orchestra director from high school, he came up and he was like, hey, like, I know that you work with pediatrics. I know that you play the viola. Is there, and I know your parents, my parents own their own business. It's an engineering company, and they do 3D printing and reverse engineering. And he was like, can we all come together and collaborate and figure out a way for these 2 5th grade girls to play the instrument that they want to play? And we were like, yes, like, let's do it. Like, let's figure this out. I was actually still a student doing my rotations at University Hospital in pediatrics. And I was like, let's figure this out. And so for our little violin player, we had to figure out a way. She had a prosthetic that she would occasionally wear if she wanted to do tumbling or gymnastics. And there was an attachment that could go on to hold her bow, so that way she could bow with one hand and hold her violin with the other. But the attachment was so expensive. if you get it from the company, it's like $2,000. And so it was very difficult for her parents to get this. And so my parents and their company and their engineers were able to design an insert that goes into her prosthetic. And we actually had her instrument switched to where she can play on her right side instead of her left side, and she could bow with the insert into her prosthetic. And so she was able to play, and she is still playing. She's in 7th grade. And then our little bass player, it was her hand that was having the issue where she wasn't able to hold the bow. And so I was able to custom make her an orthotic, a splint that fit her hand. And then my parents were able to 3D print a part that attached to the splint that held the bow onto the splint so she could bow and play the bass. And getting to see them play, getting videos and photos from their parents was incredible. And the fact that they're both still playing in 7th grade, and I've done updates on her splint and her cast or her orthotic for her hand because she's growing. And she's just still shown that interest. It's showing me that they don't even have to be my patients in the hospital. I'm able to use my skills as an occupational therapist and a viola player and help other individuals do what they want to do and show them that they can do that, and it doesn't matter like what your limitation is. It's not going to be a limitation forever in what you want to do.
Okay, so I just love that. I'm like, gosh, getting teary-eyed. I just think that that's so how God works, right? Took something, a talent that he obviously gifted you and you worked hard, and then merged that to be able to help others, and that's so inspiring. So I'd like to share, so as I mentioned, I work for Kinetic Kids, and the two co-founders who started it were pediatric physical therapists. And in the outpatient clinic, they would have kids that wanted to play basketball or they wanted to play baseball in clinic, just like their brothers and sisters, right? And so back in 2001, they took 12 kids and they started a T-ball team outside of therapy, still kept their day job, so to speak. And once a week, they were on, I think it was like the health science, ragtag field that they were able to use back then, and they started this. And then when I came on with gymnastics, very sports-minded, very, we're all kind of competitive. And so I think the story I want to share is how sport, and if you guys played sports, how it's so much more than just sport, right? Friendships are made. Parents get to sit and watch and talk, and it's so much more than just the activity. And so two different stories, again, like these guys, multiple stories, but I was helping out with our swim program, and I was talking to a grandma, and I was like, I'm so glad you're here. And she goes, oh, I wouldn't miss it. My husband's not here, but he doesn't see the gains that I see. And so, and I was like, oh, well, share. And she goes, well, my granddaughter isn't able to swim across the pool, right? But you know what she did? She got in the pool without screaming and kicking, and she was able to go underwater for just a small period of time. And she said, and you know what that does for my daughter? It opens up a whole world for her of going to the community pool with her other kids, right? Because now her child with special needs could go in the water and not make a scene, right? Or not be a danger to herself. And so she's like, this is amazing, right? And so other kids are learning strokes and doing their thing. But the impact that this had on this family was transformational in not just the grandma, because like she can go to the pool with her daughter and her grandkids, because prior to that, it was unachievable, right? And so I think that's such a neat thing. The other thing is we do surveys, and we after all of our programs for parents, and one that hit me really, I'm a mom of 5, and never have I worried about my child being invited to birthday parties or going to them. And someday there might be parents out here, but if you're not a parent yet, sometimes you're like, another birthday party, right? You're like, oh my gosh. Well, this parent said because of Kinetic Kids, because of being able to be in a sport environment, this was the first time my 12-year-old son had anybody come to his birthday party. And not just that, but was also invited to somebody's birthday party. And so I think some things that we take for granted in our own daily lives, our families with special needs, because of the different challenges that are placed upon them, and also because of society's maybe, they wouldn't want to come to my birthday party. Or maybe the child was uncomfortable going to the birthday party. So I'm not saying it was necessarily anybody's fault in the matter, but the point is through Kinetic Kids and through the programming we do, he was able to find like-minded peers. And so we think inclusion is best, and sometimes it is, but with sport, it's really challenging. By 10 years old, man, parents are brutal out on that t-ball field. And so it's just a safe space. And so the idea was to empower them, get off the sideline, into the game, right? That's our, we want them to be independent, and we want all of those things. But I think what we didn't realize at the time of starting gymnastics and t-ball and growing, the impact that would have on their lives and their ability and changing communities, their child being more accepted in the community, them feeling a part of something that's bigger than they are. And so I think when you go into these different fields, we talk in school, I think they still teach this, but this empathetic use of self, right? That we are living, walking instruments, and that we have the ability to impact lives. And so I think through all the different professions, right? Everybody could have millions of different stories of just being themselves and offering whatever talent and gift and whatever you have. But when you offer it back to somebody else, it's so not only life-giving to you, but it's also very life-changing for them. So.
Thank you so much. I want to leave a few minutes for sure for questions, but could you each give about a minute or two advice if somebody's sitting out in the audience and thinking about maybe going into some area of therapy? Any advice that you could give?
Sometimes it's hard to differentiate what we all do, and so it's just something that I've always, my just plain little way to explain it. An occupational therapist is working to make someone be able to go back into the workforce, to be able to cook dinner, to be able to do all the things in life, to get themselves whole again. A physical therapist is teaching them how to walk again, is teaching them how to move those big muscle masses, how to use the wheelchair if that is the unfortunate thing that has to happen, crutches, a walker, whatever it is. A recreation therapist teaches them how to play and have fun again. We're the ones that are taking them to, and then we all collaborate together. So we initially are doing the sports and the recreation, whether it's to go to the park, to be able to take your child to the park, to be able to just go for a canoe trip, go for a hike, whatever. But we all collaborate together. So all 3 disciplines work together. And a lot of times we pull in a speech therapist as well. And we collaborate together because we're all, as you can hear, we're all striving for the same thing, for that independence, to get those people, that person with a disability, back to where they, as close as we can to where they were before, or even better. And in many times, they end up having a better life than what they were on track for before. Because a lot of times, they got to where they are because they were on the wrong track. So it's a very fulfilling career, no matter which discipline you choose, working with people and seeing them become independent, healthy members of society.
Right. I would say the biggest advice I have for you right now at your stage of your life is you need to learn how to interview well. We were talking earlier that PT school, OT school, speech therapy school, whatever you choose, it is super competitive. And I say that to give you motivation. I'm not saying that to push you away from grad school, because as you can see, it's an awesome career, and it's so fulfilling on both sides. But I just want to, for my numbers people in the room, I just want to give you some stats here. So, for example, the year that I went to grad school, there were 1,200 applicants for that particular school. Now, that's one school, right? There's tons of schools in Texas and in the United States and worldwide, but we're talking just one school at a time, right? So 1,200 applicants for one school, only 200 of those people get interviews. So that means 1,000 people already got cut. And that doesn't mean they weren't great applicants. It's just the top 200 people got an interview. And then from there, you go through your interviews, only about 50 get accepted per year per program. So if you take that 50, compare it to the 1,200, that's 4%, right? So the interview is your gatekeeper. You can be an awesome, awesome applicant, awesome resume, awesome person, great all-around, well-rounded applicant. But if you have an awful interview, that's your gatekeeper. So I encourage you to practice with your peers, practice with your professors. I can be a resource for you as well. Just practice. Practice makes perfect for those interviews, right? And another thing is, like we've all shown, there's tons of areas in therapy that you can go into. A lot of people think that for PT, a lot of people think PT is orthopedics, right? Back pain, knee pain, hip pain. No, there's that, which is great, but there's prosthetics, there's pediatrics, there's school-based. You could be a PT for NASA, getting astronauts ready to go to space. You can be a PT at a vet's office for a dog that just had surgery. Like, there's tons of opportunities within the career. So if you feel like you're stuck, or if you're not in love with the standard of what PT is, find your niche, find what you're good at, and make it better.
Following off of what Summer was saying, if you have an area where you're like, I want to be a pediatric outpatient occupational therapist, I would keep your mind open, because you don't know what you're going to see through your observations. You don't know what other discipline, like if you might shadow a speech therapist or a physical therapist, and you might find one of those like niche areas that you want to go into, and it's okay to change where you want to go. But in addition, I would say for you guys right now, keep the balance in your life. Yes, you're looking towards grad school if that's something you want to do, or a certification for a certain field. But you also want that balance, because just how when you get to be an occupational therapist or physical therapist, recreational therapist, you're trying to show your patients that you can have that balance, like you were talking about, between work, play, sleeping. And so if you're trying to give that for your patients, but you don't have that yourself, then it's a little bit harder to connect. And also, all of those experiences that you're having, whether you're in sports, choir, fine arts, orchestra, all of those eventually are going to help you one way or another in whatever you decide to do, which is so cool. And that's what you get to do at TLU, is be involved in so many different areas and have those experiences, and you're put in those experiences for a reason. So keep those in mind, because they're going to impact someone along the way that you're going to be working with in the future.
I love how like the stair stepping, because I did not want to go into pediatrics. So that just, keeping an open mind. I was, when I finished undergrad, I got married, and my husband was in Missouri, and so I applied to Rockhurst College for my master's. When I graduated, he had got a job in San Antonio, and all the placements they had was in pediatrics. And I was like, oh my gosh, why pediatrics? But I was married, and I was like, yep, pediatrics, we'll do it, right? And so as an OT student, I met Tracy and Casey, who are the founders of Kinetic Kids, who hadn't even thought about it yet. And so as students, we met at, as well, Tracy was a student or a clinical rotation. And so you just never know, right? So I think my advice would be, for sure, piggybacking on this, keep an open mind, right? Things that you say you will never do. It's interesting how that doesn't quite work, right? So that's my first advice is have an open mind. My second is, because of all the different uniqueness within each discipline, I encourage you, and this is where my pitch is, to volunteer, right? To get out there and shadow and volunteer with pediatrics, right? Hey, pick us. You get hands-on experience. It's a great way to see multiple discipline, multiple diagnosis, all of these things. Volunteer in geriatrics, right? Find somebody that you can see, what is it like to work with someone who is, elderly? If you have a school therapist, could you shadow that, person? Ortho, that seems to be a real easy outpatient ortho to get in and view that. But I would encourage you to, if you're, in occupational therapy, or that's what you're, a psych unit, or something in the psychology, mental health industry, I just encourage you don't know what you don't know, right? And so it's hard to go as a young 20-something and I'm going to do this for the rest of my life. That's daunting, right? And so I encourage you to kind of, go in some different areas. First of all, it'll make you a much well-rounded candidate. A lot of people don't do pediatrics because it's hard to, you have to get the parent approval, blah, 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 all the things. So Kinetic Kids is really easy to volunteer. But that's a nice thing to have on your resume. It's nice to have ortho and pediatrics and geriatrics and a burn. I was able to, shadow someone in a burn clinic. That's super unique. Amputee, people who have limb length discrepancy, all of these things make you a more interesting candidate, right? There's you got to, from those 1,200 applicants, something in there on your resume has to get you pulled to actually get to the interview, right? So I encourage you to, in this time of college, don't wait to the end. It'll say 400 hours or 40 hours, 100 hours. These applicants have 400 hours. And this is not to scare you. It's just to encourage you. Start doing it now, right? And start looking at different areas, because that'll help you too. Maybe you volunteer somewhere and you run into an amazing rec therapist and you're like, that was not on my radar, right? Maybe you volunteer somewhere else and it's a great physical therapist or an OT, and then they're like, hey, I work at da-da-da-da-da, I'd love for you to shadow. So a lot of times these volunteer opportunities help us learn more about ourselves. It helps us connect with other professionals in San Antonio, in New Braunfels, and so I guess that would be my advice, is put yourself out there. That will help you ultimately narrow down some of your decisions and where you want to apply to school. So.
Okay, thank you. So let's now open it up for questions. You can ask a specific person or the panel in general. Right here in the middle. Let me repeat that for anybody who didn't hear that. I think I might have heard it. What do you recommend somebody who's had a traumatic brain injury and for balance, and what else? Okay, for both learning music as well as academics.
What I would say, if you're not already, or if you meet someone that's not already, ask for help. None of us can do all of that alone. And balancing music and education is difficult. And I think that if you have a very positive mindset and you reach out to those that can support you, and you're not afraid to ask for help, and you're not afraid to take feedback, to not criticize, but the feedback to like make you a better person, make you a better musician, make you a better student, and you work together just like we do in our field, and you work with, for example here, Dr. Jeffords, you work with a professor that's close to you, and you work with a certain medical professional, and all of that collaborating just like we do every day, I feel like that can kind of help you find that balance, because you don't want to do that by yourself. And I think that's a big thing is, as a college student, you're like, I'm independent now, like I can do this, I maybe don't need as much help, but get that help, make those connections, because you guys can all grow from those relationships. Yeah, well, thank you for sharing that, and thank you, because I think that's an inspiration to others too, and your definition of not letting anything stop you from what you're wanting to do.
Thank you. Next question. Well, I have one if they don't, but you can be thinking about yours. How did your education prepare you, and what would you have done differently, knowing what you know now in your education?
So I started out as adapted PE, like I said, and for me, it was exactly as she said, is the volunteer hours. So doing the field works and whatnot. And so I went into the adapted PE program at Seguin High School, and I quickly learned that I didn't have the patience to work with people with cognitive disabilities. I went to Texas Lions Camp and met a Paralympian and trained every night with him, because he was training for the Paralympics and I was training for college basketball. So we trained and worked out every night. And I learned about adaptive sports, about Paralympic sport. And I immediately went to Austin, because that was the only place there was a program. There wasn't one in San Antonio, because I hadn't started it yet, because I started 2 programs in San Antonio. So I went to Austin and volunteered for their program and their adapted sports program. And as soon as I walked in that gym, I realized I was home, and that's what my passion was. I looked at those kids and I didn't see the disabilities. I saw athletes that had something different. Instead of basketball shoes, they had a wheelchair. Or instead of spikes, they had a prosthetic leg. Otherwise, they were the same. They were athletes, and I was to coach them the way I would have coached any of the athletes I coached after I played college ball. I treated them the same. They just had a little bit different device that we had to learn to use, and that was fun. So that's recommending, is to go and look into those, all those different opportunities, and do the volunteer hours and learn exactly what you wanted to do. Because that taught me that I wanted to do the recreation therapy, which opened up the door for more adapted sports with physical disabilities.
Thank you, Wendy. I'm going to ask each of them to stick around in case anybody wants to just not ask a question in the whole audience, but just wants to visit one-on-one. I know some people have a 10:30 class. Be sure you see your professors if you are looking for extra credit. And at this time, can we thank the panel for coming?